hope, patience, ups and downs. For couples facing fertility issues, the road from "let's do this" to meeting a happy, healthy baby can be an emotional roller coaster. Now, there's a test that improves the odds for parents-to-be going through in vitro fertilization treatment, and it all starts with a little math. A healthy pregnancy begins with a healthy embryo. One egg has 23 chromosomes, so does one sperm. A fertilized egg contains half of mom's DNA and half of dad's. One day after fertilization, a healthy embryo begins to form with 46 chromosomes. Sometimes, a chromosome is missed, or includes too many or too few copies, causing a miscarriage or leading to birth defects. This happens 40 to 50% of the time, in fact, in older women as well as younger couples. In addition to those odds, couples going through IVF face additional challenges. It can take multiple tries to get pregnant at a high cost, financially, emotionally, psychologically, and physically. And when doctors transfer multiple embryos to improve the chance of pregnancy, the probability of twins, triplets, or more increases. That's why researchers developed pre-implantation genetic screening, or PGS, a highly specialized genetic test performed in collaboration with IVF clinics worldwide. The benefits are significant. PGS dramatically increases rates of implantation and live births. The test reduces time between IVF cycles if a second cycle is needed. PGS lowers many risks: the risk of miscarriage early in pregnancy, the risk of a live birth in which the baby has a chromosomal abnormality, such as Down syndrome, and the risk and costs associated with multiple pregnancies. Here's how it works. The fertilized egg divides into 2 cells, then 4, then 8, and so on. By day 5, there are about 128 more distinctive cells. One cluster of cells will become the fetus, another the placenta. An embryologist uses a small tool, 1/22nd the diameter of a human hair, to remove a few cells from the cluster that will become the placenta. That sample is overnighted to a Genesis genetics lab for testing, while your embryo stays safe in the care of your clinic. In the lab, we do 2 things. First, we make millions of copies of the DNA in those cells, so we have plenty to examine. Then, we count the chromosomes in each sample removed from each of your developing embryos. This information is relayed to your clinic, where you and your doctor can make a more informed decision about treatment and can transfer a healthy embryo. That means a dramatically better chance of starting a pregnancy, with lower risk of complications. Plus, other healthy embryos can be safely frozen for your future use. Our mission is to help build healthy families all over the globe, and Genesis Genetics has already done this for tens of thousands of patients. If you're thinking of IVF or have already started, ask your doctor whether PGS fits your care plan.